There is something sitting on your kitchen counter right now, or perhaps inside your refrigerator, that millions of people over the age of 60 reach for every single evening without a second thought. Some of them reach for it out of habit. Some of them reach for it because they believe it helps them unwind. Some of them have been told, by friends or by articles they half-read years ago, that it might actually be good for their heart, and almost none of them know what it is quietly doing to them while they sleep. That is what I want to talk to you about today. Not a rare drug, not an unusual supplement, something completely ordinary, something that is almost certainly a part of your evening routine right now. And something that, after the age of 60, can place your heart under a kind of stress that most people never see coming, precisely because it happens after they have already closed their eyes. My name is Dr. Mason Hayes, and I have spent more than 2 decades working directly with patients who have cardiovascular disease, studying how lifestyle habits intersect with heart health, and trying to understand why certain people suffer cardiac events during the night that their families never saw coming. In all of that time, one pattern has surprised me more than almost any other. It is not the dramatic habits that do the most consistent damage, it is the quiet ones, the routine ones, the ones people defend because they have been doing them for years and nothing bad has happened yet. Tonight I am going to explain exactly what those drinks are, why they are particularly dangerous after 60, and what the science actually says about how to protect yourself during the most vulnerable hours of every single night. Stay with me, because what you are about to learn is something most people in their 60s are never told clearly enough. Let me start with something that almost every patient is surprised to hear me say. Your heart does not experience the nighttime the way you do. When you climb into bed and drift off to sleep, you feel a sense of rest and stillness. Your heart experiences something far more complex. In a body that is working properly, the hours between midnight and early morning represent a critical period of biological repair. Blood pressure falls. Heart rate slows, arterial walls relax, your entire cardiovascular system shifts into a kind of overnight maintenance cycle that it has been designed to perform every single night of your life. But after the age of 60, that system becomes more fragile. Your blood vessels have stiffened over the decades, your body's ability to regulate pressure with precision has weakened, the hormonal signals that once guarded your heart through those quiet hours have become less reliable. What this means practically is that anything you put into your body in the hours before sleep does not just affect you while you are awake, it follows you into the night, it alters the environment your heart is trying to repair itself in. And for a cardiovascular system that already has less margin for error than it once did, that matters far more than most people understand. This is exactly why the first drink I need to talk to you about surprises people so much, not because it is unfamiliar, but because so many people genuinely believe it is helping them. I am talking about alcohol. I want to be careful here, because this is a topic surrounded by a great deal of confusion, and I think that confusion has caused real harm to real patients over many years. You have probably heard that a glass of wine in the evening can be relaxing. You may have read something at some point about red wine and heart health. You may even have a physician who told you years ago that moderate drinking was not something to worry about. And I understand why all of that has accumulated into a sense that a quiet drink before bed is harmless or even beneficial. But the science has continued to evolve, and what it now tells us is considerably more sobering than that. The American Heart Association has made it consistently clear that heavy alcohol consumption, generally defined as more than 2 drinks per day, is directly linked to higher blood pressure, a greater risk of coronary artery disease, a higher likelihood of developing dangerous heart rhythm disorders, and an increased risk of both heart failure and stroke. These are not subtle associations, these are strong, repeated findings across decades of research. And the mechanism is not mysterious at all. When you drink alcohol, even in moderate amounts, it acts as a vasodilator in the short term. Your blood vessels widen, your heart rate climbs, your blood pressure, rather than taking its natural evening dip, stays elevated or rises. And then, as the alcohol begins to wear off a few hours later, something called a rebound effect occurs. The nervous system, which alcohol had been suppressing, becomes suddenly more active, blood pressure spikes, heart rate accelerates, stress hormones flood the body. This rebound hits its peak in the early morning hours, typically between 2 and 5 in the morning, precisely the window when the cardiovascular system is supposed to be at its quietest and most protected. Now layer onto that what alcohol does to your sleep architecture. Many people believe that a drink before bed helps them sleep because they fall asleep faster, and that part is true. Alcohol does speed up the onset of sleep, but it fundamentally destroys the quality of that sleep. It suppresses REM sleep, the stage in which your brain consolidates memory and your body regulates stress hormones most efficiently. It increases nighttime awakenings. It causes breathing disruptions that in someone with any degree of underlying sleep apnea becomes significantly more dangerous. The American Heart Association is clear that healthy sleep is one of what they call life's essential 8, the foundational behaviors for cardiovascular health. 7 to 9 hours of quality sleep each night reduces the risk of heart disease and stroke in ways that are measurable and meaningful. Alcohol does not help you achieve that. It takes it away from you, quietly, while you believe you are resting. I have had patients who told me they had been having a glass of wine every night for 30 years and felt completely fine, and I tell them the same thing I will tell you now. The absence of an obvious acute event does not mean the cumulative effect is not happening. Your arterial walls do not announce when they are stiffening. Your heart rhythm does not send you a warning letter before it begins to change. The damage accumulates in silence, which is exactly what makes this so important to understand before something irreversible happens. Now I want to tell you about the second drink, because this one surprises my patients even more. And the reason it surprises them is that many of them do not even realize they are consuming it. I am talking about caffeine, and more specifically, I am talking about caffeine consumed in the afternoon and evening in ways that people have simply stopped noticing. The American Heart Association's scientific statement on caffeine and cardiovascular disease explains the mechanism very clearly. Caffeine works by blocking adenosine receptors in the brain. Adenosine is a chemical that builds up throughout the day and creates the sensation of tiredness that your body uses to guide you towards sleep. When caffeine blocks those receptors, it increases what is called sympathetic activity. That is the branch of your nervous system that governs the fight-or-flight response. It causes a temporary rise in blood pressure. It causes your heart rate to climb. It creates a state of heightened physiological alertness that your body was not supposed to be in as the evening progresses. Now here is the part that many people do not know. Caffeine has a half-life in the adult body of approximately 5 to 7 hours. In people over 60, it can be even longer, because the liver enzyme primarily responsible for metabolizing caffeine, CYP1A2, becomes less efficient with age and with many common medications. What this means is that a cup of coffee, consumed at 3 in the afternoon, still has a significant amount of active caffeine circulating in your bloodstream at 10 or 11 at night when you are trying to fall asleep. And it is not just coffee. Caffeinated tea contains it. Many sodas contain it. Certain medications contain it. Energy drinks, which the American Heart Association has specifically flagged as a category of concern, can contain amounts of caffeine far beyond what is found in a standard cup of coffee, and have been associated in case reports with serious cardiac arrhythmias. The particular danger for someone over 60 is this: your heart at night is trying to slow down. It is trying to reduce its output, lower the pressure in your arteries, and allow the repair processes that protect you to take place. Caffeine is working against every single one of those goals simultaneously. It is telling your sympathetic nervous system to stay alert. It is keeping your blood pressure elevated at a time when your body expects and needs it to fall. And it is fragmenting your sleep in a way that compounds the cardiovascular risk rather than relieving it. I have patients who stop drinking coffee at noon and believe they are being careful, and they may be. But then I ask them about their afternoon tea, and the answer is usually that they have 2 or 3 cups between lunch and dinner. I ask them about their evening soda. I ask them about the decaf coffee they switched to, which, contrary to what most people assume, still contains a meaningful amount of caffeine, typically somewhere between 15 and 30 milligrams per cup. And when we add all of that up together, the picture changes considerably from the one they had in their mind. The AHA findings on caffeine are nuanced, and I want to be fair about that. Moderate caffeinated coffee consumption in the range of 2 to 3 cups per day is actually associated in the research with a lower risk of coronary artery disease and stroke. Low to moderate intake has also been linked to a reduced risk of heart failure. So this is not a story about caffeine being simply good or simply bad. The story is about timing, quantity, and the vulnerability of the aging cardiovascular system during sleep. A cup of coffee in the morning may be perfectly fine. That same cup consumed at 7 in the evening is a completely different proposition for your heart. Let me also address the red wine question directly, because I know it is in the back of many viewers' minds. For years, the idea that red wine was uniquely protective for the heart circulated widely in popular culture. Some studies did show associations between moderate wine consumption and better cardiovascular outcomes. But the American Heart Association has consistently cautioned that those associations are far more complicated than they initially appeared. Many of the people who drink moderate amounts of wine also have other health protective lifestyle behaviors. Separating the effect of the wine from the effect of everything else they are doing is genuinely difficult. And in the meantime, the direct mechanisms by which alcohol elevates blood pressure, disrupts sleep architecture, and triggers the early morning rebound effect do not disappear simply because the drink came from a wine glass. If you do not currently drink alcohol, the American Heart Association's position is clear and unambiguous. Do not start for any purported heart benefit. There is no established threshold of consumption that your doctor can confidently recommend as safe for your heart. So where does this leave you practically? What should you be doing instead? The answer is simpler than most people expect, and it costs nothing. Set a cutoff for caffeine at noon or early afternoon and hold to it consistently. Be honest with yourself about the hidden sources. Read the labels of your teas and sodas. Ask your pharmacist whether any of your regular medications contain caffeine, because some common pain relievers do, and most people have never checked. If you want a warm drink in the evening, herbal tea, true decaf used sparingly, or warm water with a small amount of lemon is a far better choice for your cardiovascular system than anything containing caffeine. On the question of alcohol, if you currently drink, talk honestly with your physician about what moderation actually means for your specific health situation, particularly if you have any history of high blood pressure, irregular heart rhythms, or sleep apnea. The AHA recommendation for people who choose to drink is no more than 1 drink per day for women and 2 per day for men, but the timing matters just as much as the quantity. Drinking even within those limits in the 2 to 3 hours before bed still places your heart in that rebound zone during the most vulnerable hours of the night. If you are going to drink at all, earlier in the evening is meaningfully better than later. Now I want to speak to you honestly for a moment, the way I speak to patients who are sitting across from me rather than watching a video. I have reviewed charts and spoken with families in the aftermath of cardiac events that took place quietly, in the early hours of the morning, in people who had no idea anything was wrong when they said goodnight. And when I look back through the patterns of what those evenings looked like, the alcohol consumed a few hours before bed is there with remarkable consistency. So is the caffeine that was never fully cleared. So is the disrupted sleep architecture that no one noticed because no one was measuring it. These are not rare vulnerabilities affecting a small number of people. According to the American Heart Association, the hours between midnight and 6 in the morning carry the highest risk of heart attack and stroke for adults, and the habits of the evening are a significant part of why. The drinks you reach for before bed are not neutral choices. They are either working with your heart's nightly repair cycle or against it, and after 60, there is far less room for that working against you than there used to be. Here's what I want you to take from tonight. 3 simple changes. Just 3. First, move your caffeine cutoff to noon, not because coffee is dangerous in the morning, but because the aging body needs those afternoon and evening hours free of sympathetic stimulation so the heart can begin winding down long before you actually get into bed. Second, if you drink alcohol, move it earlier and reduce the quantity close to bedtime. Your heart needs the evening hours to transition out of the rebound zone before you fall asleep, not to still be inside it. Third, replace the evening drink with something that actively supports what your heart is trying to do during the night. Water, herbal tea, a warm, quiet moment that costs nothing but gives your cardiovascular system exactly what it needs. Small choices, repeated faithfully. That is what protects the heart across years and decades, not dramatic interventions, not expensive treatments, ordinary evenings, handled with a little more intention than before. If this felt useful to you today, I would ask you to share it with someone you care about. Someone over 60 who still has a glass of something beside them at 9 at night without knowing what it is doing in the hours that follow. Send them this. Let them have the information too. And one last thought before we part. Everything I have shared here is grounded in current cardiovascular research and in my own clinical experience over more than 2 decades. It is intended as general health information, not a substitute for personalized medical advice. Before making changes to your diet, your medications, or your approach to alcohol, if you have a specific health history, please speak with your own physician. That is not a disclaimer I say because I have to. It is something I say because your history and your situation are specific to you, and general information, no matter how well grounded, is never the same as a conversation with someone who knows your chart. My name is Dr. Mason Hayes. Take care of your heart tonight. Set down the drink that is working against it. Give your body the quiet it has been asking for, and sleep well, knowing that you just did something genuinely good for the organ that has never once stopped working faithfully for you.